This is the ITEC 610-940 Information Technology Foundation's group paper on Health Information Technology Architecture for Group 3. The Suburban Independent Clinic, a subsidiary of Largo Corporation, needs to address the cost, quality of care, access, and efficiencies. Its mission statement is to uphold the clinical staff members to best serve the patients. It focuses on delivering high-quality medical care, also looking at a patient-centric organization that optimizes the visits, including communication standards and as well as patient understanding. Focuses on patient respect, including patient confidentiality, and also promotes a positive work environment for its patients as well as its employees. Its goals is to adapt regulatory processes in compliance with the Affordable Care Act. In addition, it wants to implement a health information technology to support a new health technology initiative to improve access, delivery, efficiency, and overall quality of health care. The agenda consists of the purpose, the overall environment, analysis of the issues, relevant technologies, overall recommendations and migration strategy, and conclusions. The purpose is to determine the issues faced by Suburban Independent Clinic and develop a new IT architecture for the facility. The plans are to reduce costs while providing quality services, implementing information technology to improve efficiencies on day-to-day operations. In addition, you want to organize medical records to be more HIPAA sensitive, as well as sharing the files accurately. Lastly, it wants to promote transparency on both ends and provide equal attention and care to all patients. As mentioned earlier, the Suburban Independent Clinic is a subsidiary of Largo Corporation. It provides general outpatient medical needs in the suburb just outside of DC. It directly competes with CVS MinuteClinic and Urgent Care. The personnel includes a clinical director, nurses, physicians, a health information manager. Challenges are the overwhelming pressure to improve management and information technology. And across the board, there's a number of issues regarding transparency, clarification, organization, supplies, and efficiencies. The next section we're going to cover is the analysis of issues, and it consists of an overall approach, looking at an issue matrix organization, the actual tracking sheet, and the analysis. Before we begin the analysis, we want to talk about the approach. What you'll see here is our body of work and how we went ahead and applied the analysis. If you see over on your left hand side, 1, 2, 3, 4 are the different levels of how we approached it. Number 1, we looked at the different phases. Number 2, we looked at the what we're going to accomplish for each phase. Level number 3 is the how, looking at the different levels of information that we bring together. And then number 4 are the actual outcomes. Let's take a look at the first level of the phase. In this level 1, 2, 3, and 4, we're going to go ahead and we're gathering the information, we're doing the analysis, providing results, and then based on the results we're looking at some recommendations. The next level, what we're doing is on the what for each phase. So if you look at number 1, what we're doing is we're collecting information from the source. If you look at number 2, what we're doing is we're analyzing information to be collected from the gathered information of the phase. We're going to, what we're doing for number 3 is reviewing the results, and number 4, what we're doing is providing recommendations. Immediately after that, the level number 3 is the how. If you look at how we're gathering, how we're performing the information in phase 1, we're looking at the sources, the patient feedback, the employee feedback, the organizational structure, and the mission statement. If you look at number 2, the how we're doing the analysis, number 3, how we're doing the results, and number 4, how we're doing the recommendations. At the bottom level are the outcomes, and the outcomes are the end result of the phase. In this case, you look at number 1, the outcomes from gathering information is understanding the pain points, identifying process flows, and identifying communication exchanges. Same with the analysis of number 2, same with results of number 3, same with recommendations on number 4. If you do notice at each phase, you can track through each level based on the color code. Next, we're going to look at how the issues matrix is organized. If you notice on the top, 1 through 6, we're going to talk through that. Number 1 is identified as the issue type. If you see here, there's cost, quality of care. Number 2 is the items that were tracked for that patient with respect to the issue type. Number 3 is items that are tracked for the physician with respect to the issue type. Number 4 with the nurse with the issue type. Number 5 is with the office manager. And then number 6 is a detailed analysis of each item. So this slide is the second slide of the issues matrix, and you can see that there's different issue types for the patient, physician, nurse, office manager, as well as corresponding analysis. The other issue types are here are access, efficiency, and disease and or personal injury. And this is the details of where we're going to do our analysis on. The issues analysis consists of 2 different views. The first view looks at the access, cost, efficiency, and quality of care with respect to the roles. The roles are the physician, patient, office manager, and nurse. And what the top table has identified that physicians have the majority, 33% of all issues. The table below that looks at a little differently. It looks at the priority of the issues, high and medium, with respect to the roles of physician, office manager, nurse, and patient. And once again, physicians have the highest number of high priorities, and those are the ones that we're going to be addressing. This section examines technologies relevant to SIC's issues. The technologies we're going to be looking at are the electronic health records, computerized provider order entry, barcode medication administration, electronic medication management, workstations on wheels, and mobile applications. So let's talk about technology utilization. As you can see here, we have technology in the center that helps address the SIC's issues. Its corresponding value on the left and the benefit on the right. So here we're going to talk about electronic health records, or EHR. So the value of EHR provides the optimization and also efficiencies that help patients participate as well as access the system, allows transparency between the physicians as well as administrators. The benefits are, because of the patient portal, the patients become more invested in the ownership of their overall health. The next technology we're going to look at is computerized provider order entry, or CPOE. CPOE is a process used by healthcare providers to enter and send treatment instructions electronically. CPOE reduces errors by ensuring that all orders and signatures are legible. The values is an effective tool for processing prescriptions. Benefits are clear. The prescribing errors were reduced by 48%, as well as it has an auto check feature for drug interaction and medication allergies. The next technology we're looking at is barcode medication administration. This is a process that involves the use of electronic barcode scanning technology to help nurses ensure patients receive the correct medication dosage. The value is its accuracy for medication dosage and individualized for each patient. The benefits are the right patient receives the right drug via the right route in the right dosage at the right time. The technology we're going to look at now is electronic medication management. EMM systems are responsible for improving the quality, safety, and effectiveness of medication management in medical facilities. Its value is it eliminates risk of error in prescriptions or dosing by filling orders. The benefits are it prevents medication prescription and dispensing errors. The next technology is workstation on wheels. This technology affords nurses the ability to chart at the bedside, review care instructions, and administer medication accordingly. The value is the mobile station and or tablet will have everything the nurse will need to check and treat patients. The benefits are that both physicians and nurses will be able to spend more time listening to the patients, discussing treatment options, and delivering quality care. The last technology we're looking at is mobile applications. Mobile healthcare apps are becoming increasingly popular in the healthcare industry. Value is they assist patients with treatment plans and advice while also providing medical material to patients as well as providers. The benefits are they strengthen communications and streamline the processes between the different departments, labs, medical staff, as well as patients. In the migration strategy, we're going to cover 3 areas: patient feedback, management strategy overview, and management strategy timeline. One of the areas we want to go ahead and focus on is patient feedback. It's important that the appointments for scheduling be much easier. We don't want the patients to wait longer to complete the forms. We want to make it electronic. We also want to find ways that the pharmacist can clearly identify the medications being used by the prescribing patients. The migration plan is based off a framework. What you see here on your left is the actual framework, and then what you see on the right is the out product of that framework. In this case, it's a workflow. So the framework, and going through the framework, we have current situation definition, requirements definition. We want provider analysis as well as provider assessment, a decision and migration, and then follow-up. The areas that we have the problems on are the physicians, so we want to look at item number 4, which is provider assessment. That leads into the workflow, and as you can see, the workflow goes into determining the best practices and addresses all the areas with respect to cost and efficiencies and the quality of care. One of the things we want to do is just talk about the value of migrating systems here at SIC. I want to read through a quote from Max Telmark, who is a technology evangelist. Everything I love about the civilization is a product of intelligence. So amplifying our human intelligence with artificial intelligence has the potential of helping civilization flourish like never before, as long as we manage to keep the technology beneficial. The Office of the CIO is recommending the creation of a new vision, health information, and quality improvement team. In addition, it's recommending the organizational effort working toward well-organized strategies and goals. The information technology architecture provides reduced cost by eliminating error, duplication, redundancy, focuses on patient and family engagement. It improves the way physicians and patients communicate. Also provides proper utilization of supplies and shortages. And more importantly, it's offering continuity of care in a timely and effective manner. Lastly, it provides a rewarding atmosphere for patients and staff. Now, this can only be successful if we get the support from our senior leadership. Thank you.